Thank you, Rashmi, for the good words. Ladies and gentlemen, I'm very happy that the organizers have kept healthcare sector as one of the topic in the deliberation of this technology congress. Delivering affordable healthcare to India's billions, or billion plus, I would say, present enormous challenges and opportunities for the medical community, insurers, and other service providers. Innovative technologies, processes, and partnerships forged by the Indian government and private companies have begun bridging the healthcare gap that we had. Advances are underway on several fronts from expanding health insurance coverage for the poor and building hospitals in smaller towns, to using technology for safer drinking water and improving treatment outcomes. However, all these efforts seem to be islands of excellence in an ocean of inadequacy. We need to focus on scaling what we do to reach out to a billion people with a sustainable model that overcomes the challenges of geography. Many reputed hospitals recently launched a telemedicine service with health insurance. In this effort, and for another telemedicine venture operated through community service centers, the hospitals have partnered with IT companies like Cisco, General Electric, Siemens, Wipro Technologies, and including ISRO for the satellite communications. The constant challenge the healthcare industry faces is to provide quality healthcare that is also affordable. The imperative gets brutally dark at times. If you know somebody sold their land or ornaments to finance a bypass surgery for their father, mother, or husband, or wife, you are going to do everything you can to make sure the cost is low. While we have challenges, we do have the use of IT/healthcare convergence as an opportunity. Innovation is the only way to deal with the size of India's unmet healthcare needs. We have to do things differently. Yesterday's or today's methodologies to practice healthcare does not work for tomorrow. Some of the suggestions in this area would be perhaps the importance of convergence of healthcare as the biggest thing we can do, immense possibilities that could result from bringing together healthcare, IT, and mobile phones. With over 600 million mobile phone users in the country, almost 80% of adult in India has cell phone. How can we use that to heighten health awareness and prevention and provide appropriate access to the right healthcare? The mobile phone can't do a bypass surgery, sure, but it can do something to prevent cardiac surgery, at least to a degree. It can help people to know where to go and call an ambulance. Talking of challenges and opportunities, there are always buts involved. The gaps are huge. Our vaccination rates are very low even now. That is unconscionable for a country with profile, aspirations, and the installed healthcare base that we have. Look at mortality rates, especially from trivial diseases. The list is long and people still suffer from diseases like cholera. India's healthcare industry needs managers with knowledge about the reality at the ground level to help grapple with those challenges. Leaders also need to understand that the scope of India healthcare gaps, work to build infrastructure to reach rural pockets, and to create innovative financing to deliver healthcare to the underprivileged. creating incentives for local companies, roping in support from global players, and putting in place public-private partnerships ought to be the thrust areas for the Indian healthcare services industry. To deal with these, few of which I have mentioned, we have 4 brilliant speakers, expert in each area, with us today. Before we go to the task, I'll take a minute for some time management are the directions for the question answer session after the speakers give their advice to us. Each session is likely to be approximately 20 minutes, followed by question and answer sessions depending upon the response, 5 or maximum 10 minutes. We shall have question and answers at the end of each session. The person who wants to ask the question should raise hand. We will have a mic on the, instead of saving time while for coming here and asking the question, we'll try to provide. I think Nandunja has arranged some mics on the floor and they will reach you faster. The question should be relevant, very brief, and should not narrate a story, since we are already half an hour late. We have started half an hour late, and I'm sure, considering the lunch following this session, you will not like to delay too much. Ladies and gentlemen, this session, I said so, is just before lunch, and the pre-lunch sessions they are notorious in their own way. But I'm sure the interesting talk of our speakers will keep you at the edge of your seats and not let you go into slumber on the cozy seats of Nimans. We have the first panelist in Professor Sui Hin Teo, who has come all the way from Singapore. I'll request you to join me in giving him a big hand. Brief introduction about Professor Teo. Professor Teo received his B. Engineering and PhD from Monash University, Australia in 1978 and 1982 respectively. He is presently Professor, Division Bioengineering, School of Chemical and Biomedical Engineering, Nanyang Technological University in Singapore, and he is also a Fellow of the Academy of Engineers, Singapore. He is Chairman of the NUS Graduate Bioengineering Program. He was there from 1999 to 2005 and has helped NUS to attract one of the best cohort and most talented group of graduate students in bioengineering. He presently serves as the President and Chairman, Board of Director, Osteopore International. It is here that he guided the company to obtain FDA approval and CE mark and the marketing and distribution of the scaffolds worldwide. The scaffolds have now been implanted successfully, I'm told, in more than 1,500 patients. Professor Teo's main field of research in biomaterials is in biomaterials and tissue engineering. He is well known for his outstanding contribution to the 3D bioresorbable scaffolds for bone, where it has obtained FDA and CA mark, as I said earlier. He did pioneering work in fracture wear resistant biomaterials. He received the prestigious Golden Innovation Award from Far East Economic Review and the Institution of Engineers prestigious Engineering Achievement Award in 2004. Professor Teo contributes significantly to professional bodies. He is presently the chairman, Singapore Academy, Asia Regulatory Professional Association. He sits in as Board of Editors, Tissue Engineering, Journal of Tissue Engineering, Regenerative Medicine, and many other journals. May I invite Professor Teo to take up the floor. Thank you.